This is Cassie. She's a 10-year-old Palomino mare. She can be quite bolshy. She's got lots of character. And she's on box rest at the moment due to Laminitis, a very common equine condition. And we're here today to help her self-medicate on medicinal herbs and oils to see if she would like to use them to reduce any pain and inflammation, to improve the circulation to her feet, and to help improve her digestive system and improve the function of her digestive system and help her to get over this bout of laminitis as quickly as possible. Here you can see me giving her some barley grass on my hands, actually made by Equine, this product. It's called Green Zymes. Really very effective. It helps to reduce acidity in the body. It's a very alkaline plant, barley grass, and it's also bursting with vitamins and minerals, so it's a really great way for Cassie to make sure she's got all the supplements she needs, as she's obviously on very reduced feed at the moment and not allowed any turnout. You can see how enthusiastic she is about this. She's licking it off the palm of my hand very enthusiastically with her tongue, and when she's finished licking it off my hand, she goes back to the packet to ask me for more. I really encourage owners to make sure that their animals know how to ask for more, so that they can be in charge of their dosage and they can control their dosage. That way we know they're getting enough of the remedies that they need. I've worked with Cassie before, so she's a pro at working with herbs and oils. She knows exactly what she's doing. She knows how to communicate with me that she needs more. And you can also see that she gets really soft and relaxed in her face when she finds a remedy that she likes. So we're going to take you through a little bit of Cassie's consult now and show you how she reacts to a range of herbal remedies and essential oils. The most important thing for me as a zoo pharmacognosist working with animals is that I really let the animals guide the session. It's for them to tell me when they've had enough. It's for them to say what they want and also to choose how to take what they want. Some remedies are just needed through inhalation. Other remedies, as you can see here with the barley grass, are taken from the hand using the tongue. Other times an animal may lick a remedy from your hand and they may apply it to a part of their body. I've had this happen several times when I'm working with dogs, and they've licked an anti-inflammatory remedy from my hand and applied it to their own painful joint. So they're very clever animals, knowing how to use these remedies intuitively. So here I'm just going to open a bottle and allow Cassie to have a little look. I'm encouraging her to smell it. She's quite keen to lick it. She's making a very quick decision, and I want her to convince me that she definitely wants to take this remedy internally. What I'm doing now is I'm blending that essential oil with a macerated oil, a carrier oil. Essential oils are very, very powerful, and they can irritate the mucous membranes of the nose and mouth if they're given neat. So you'll see me blending the essential oil in actually calendula oil in this case for Cassie, to avoid any stinging or burning of her mouth. And once I've mixed it, I allow her to lick it. When you do this with your animals, you'll really begin to feel the difference between their levels of enthusiasm, how quickly they lick the remedies from your hand, how much of their tongue they use, whether they use the underside of their tongue. When an animal uses the underside of their tongue, they're telling you that they need that remedy more urgently. The underside of the tongue has a rich vasculature, and it's a very fast route for the remedies into the bloodstream. So if you watch your animal take a remedy with the underside of the tongue, know that they really do need that remedy quite urgently in their body. Equally, if you offer that same remedy later that day and the next day, and they start to use the underside and top of their tongue, and the day after they just use the top of their tongue, you can feel really confident that the pain, discomfort or condition they were struggling with is improving already. So the animals give us so much information. Let's see how Cassie responds to this next remedy. So, she's smelling, she's mouthing, she's licking at the bottle, she's enthusiastic while I put it on my hand. I've worked with many horses with laminitis. It's a condition that we come across all the time, so I do know the types of remedies that they're most likely to go for. So I'm picking things that I think Cassie will like. But you can see with this one, she's cleaned my hand, and now she's looking quite distracted. She certainly is not saying to me that she wants any more. In fact, she's looking a little bit less than impressed about that one, and she's had another sniff, and she's saying, actually, I don't want any more of that, thank you. So that's a beautiful example of how our animals can control their dosage. Let's see what she asks for now. Is she going to take a break? Is she going to ask for more remedies? Let's see. That's always a great sign. When we see a horse yawning or stretching during a consult, that normally indicates that there's some kind of release going on, normally an emotional release. So maybe there's an emotional connection to Cassie's laminitis. We know that she's a rescue horse. She has had quite a traumatic background. Let's see. I'm offering her yarrow here. This is an anti-inflammatory and analgesic herb. Yarrow grows in most English fields. We see it commonly. Yarrow was used during the war to stem bleeding in the wounds of soldiers. It's got a very famous history. It's a natural antiseptic and antibacterial, and I'm sure that today Cassie's probably taking it for its anti-inflammatory benefits. So now I'm asking her, do you want more? When I asked her that about the last remedy, she said no thank you, and this one she says definitely yes please, can I have some more? So I'm putting 2 or 3 drops of neat yarrow on my hand, and I'm blending it in calendula. Here you can see Cassie doing phlegmon. Phlegmon is the fastest way for her to analyse a smell. It's a very advanced part of her olfactory system. So she's using that to send the messages to her brain and make a decision about whether she wants some more, and it was a definite yes. I think she's going to do phlegmon again for us one more time. Many animals do phlegmon, dogs and cats do it too. They're just generally not as obvious as the horses are. You can see she's still really enthusiastic coming back to this yarrow again. It's good. By backing away and moving away, Cassie shows us that she's had enough of that remedy, and it's time for me to get something else out of my kit and see if there's something else in there that she would like today and need today. When I'm finished working with Cassie, I'll be leaving a bottle of each of the remedies that she's chosen with her owner, and her owner will continue to offer these every day until Cassie no longer wants them. That may be for a week or a month or 6 months. That's something I can never answer, and that really does depend on the horse and the condition that we're treating. I'm offering Cassie now peppermint. Peppermint's brilliant for laminitis. It's a very powerful analgesic and anti-inflammatory. She's licked that straight off my hand. She's half doing phlegmon. She's licking her lips. All very positive signs. And again, we'll just watch and give Cassie time and see if she would like any more of that, or if the 2 drops that I've just given her were enough. When I leave after a consultation with an animal, I always ask the owner to keep a diary of their animal's responses. That way we can see if there are any patterns, and we can also see if the animal is improving. It's quite common for their dosage to be reduced over the following few days. They may take less of the things they were very keen on when I was here. Equally, if there's an upset in the routine, if there's a stress on the yard, if they were given the wrong feed, anything, any number of environmental factors can obviously cause them to have a minor relapse in their condition, and you may see that their self-selection and their dosage increases for a short period of time. Cassie's having a real moment here while the oils start to take effect. They do work very quickly. When you're working with your remedies, with your animals, don't rush them. Give them time. They're using their intuition to heal themselves, and to heal themselves with nature's pharmacy, the natural way.